Now let's look at the direction of this question. It says read the argument and answer the question that follows. So it's a critical reasoning question. Let's look at the question now. The argument which is given to us is, while treating patients suffering from Down syndrome, doctors realized that an overdose of medicine given to a patient who also had the high blood sugar levels made him or her resilient. Seeing the drastic recovery in such patients, the doctors believe that patients with high blood sugar levels along with other genetic birth defects can also be treated successfully when they are given overdoses of the prescribed medicines. So here there is an argument which talks about doctors experimenting on someone with a Down syndrome, and they say that since they gave him an overdose of medicine and the patient who also had a high blood sugar level and was administered an overdose of medicine, he became resilient, quick to recovery. So now the doctors are taking the hypothesis further, and they are saying that the drastic recovery in such patients, doctors are believing that people with high blood sugar levels along with other genetic birth defects can also be treated successfully if they are given overdoses of medicines. Right, quite an interesting argument it looks. So let's look at the question now. Which of the following statements shows a flaw in the reasoning of the doctors? Yes, of course, there is a flaw in the reasoning, because what is happening is doctors are taking the case of a person who is suffering from a particular disease which is Down syndrome, and since he was given an overdose and he became alright, doctors are also believing that people with other diseases and other genetic birth defects and other having high blood pressure and high blood sugar levels can be given high doses and they can be treated. So let's look at the options now, and let's see which one of the statements would show us a flaw. Now let's look at option number 1. Option number 1 says treating patients who are suffering from genetic birth defects and have high blood sugar levels through an overdose has no permanent impact on their physical condition. Now here the argument is assuming too much. The option is assuming too much, and it does not anyways show us the flaw, therefore it can be negated. Let's look at the second option. It says successfully treating patients suffering from both high blood sugar levels and Down syndrome suggests that those suffering only with Down syndrome have little hope of recovery. Now this is something which is contradictory to the argument and it does not highlight the flaw, therefore it also becomes incorrect. Let's look at the third one. It says high blood sugar levels could be specifically conducive in the treatment of patients with Down syndrome. Yes, this is exactly what was happening. The patients who became resilient were the people who were being treated for Down syndrome and had high blood sugar levels. So this statement clearly states the flaw in the reasoning or the hypothesis that the doctors are making, and the hypothesis which the doctors are making are that if overdoses are given to people with high blood sugar levels and other genetic defects, they would also be cured like the patients with the Down syndrome. So therefore this statement highlights the flaw in the doctor's reasoning. Let's keep it at bay. Let's examine the other options, because in critical reasoning we always go by the process of elimination rather than by the process of selection. Treatments of diseases related to genetics are usually similar in most cases and have very little variation, which is only in terms of the dosage of prescribed medicines. Now this is out of the scope of the argument, therefore it becomes incorrect. Let's look at the fifth one. Overdoses of medicines prescribed intentionally by the doctors may be fatal for those suffering solely with Down syndrome. No, but those patients were cured. Therefore this contradicts the argument and it also goes for a toss. So the only statement that gives us the flaw in the doctor's reasoning is statement number 3, and hence it becomes the correct answer choice. Thank you.